Watching BSN News. I'm Livia Nagy here at Dubstrike Golf Course. We're about to meet Joe, an 85-year-old who's trying to be the oldest man to participate in the PGA Tour. Let's go ahead and meet him.
Well, I've been golfing for the last 60 years. I've been golfing with my wife, but she came out with dementia, so it's very hard for her to get out of the house without assistance. So I've been golfing just for her spirit. She always wanted me to go for the PGA, and I figured now that I'm 85, I should go for it before anything else happens. And she can still be there, so she can cheer me on. I just want to bring your spirit back.
Let's see that stroke, Joe. Here with Priya, Joe's nurse, to see how he's doing. How's he feeling?
Well, he actually had a stroke. That's what brought him in. And yesterday he fell, so for the medicines for the stroke, we decided to give him Plavix for the anti-clots, and then Lipitor to lower his cholesterol, and then after his fall, we gave him some ibuprofen for the pain.
Okay, cool. Well, can we go in and talk with Joe? Do you think that'd be okay if we watched you guys?
Absolutely.
All right, let's go in and check.
All right, Mr. Joe, I have your medications here. I have Plavix, Lipitor, and ibuprofen. Do you understand why you're taking Plavix?
Yes, I don't throw a clot.
Do you understand why you're taking Lipitor?
Yeah, it's already lowering my cholesterol. I can feel it.
And do you understand why you're taking ibuprofen?
Yeah, I can already feel my pain going away.
Do you know any side effects to look for?
If I throw out my coffee, that's a problem.
I think we're going to go to the newsroom and learn a little bit more about these meds because we need more patient education.
Thanks, Livia. I'm Jen, and I'm here to give you some more patient education. The first drug that Joe is on is Plavix. And Plavix is used to keep the platelets in your blood from clotting. The second drug that Joe is on is Lipitor, and Lipitor is used to help lower the bad cholesterol in your system. One important reminder about these two drugs is they do compete for the same activation site. So it's important to talk to your doctor to make sure that your levels are good on both of those. The last drug that Joe is on is from his fall, and that is ibuprofen, and that is to help with his pain and inflammation from that fall. Some other important reminders about ibuprofen is to ensure that you take it with food or milk to help calm down any stomach upset that it may cause. Before taking any of these meds, it is important to check yourself out for any unusual bruising or bleeding that may be occurring in your body. If those symptoms occur, it'd be very important for you to call your doctor. Some other things that you need to be aware of and call your doctor if they occur is any unusual prolonged bleeding that will not stop, blood in your urine or stool, coughing or vomiting up blood, which could look like coffee grounds, sudden headaches, blurred vision or confusion, trouble urinating or not urinating at all, chest pain, unexplained fever. Some less serious side effects that you may want to talk to your doctor about, but is not important to call them right away, would be itching, upset stomach, bloating, diarrhea, and constipation. Now let's go check back on Joe.
Thanks, Jen. Joe's feeling up to having an interview with us, so we're going to go in and talk to him. So, Joe, how are you feeling?
I'm doing okay. Just thinking about, because you don't stay in hospitals all the time. So I'm just thinking about like when I get out. It's like, I don't know how I'm going to be able to afford my medication. I really don't. And I'm afraid of that. Because we don't have a lot of money. Yeah, my wife, she's not doing well. She has dementia.
I remember you mentioned that. Well, we're going to bring in Joe's nurse and see if we can help.
So, Mr. Joe, I heard that you were having some concerns over the cost of the medications and to help your wife. So I have some resources for you. For the cost, I don't want you to worry too much about it because we can get the pharmaceutical companies to give you generic versions of the medications. So they're much cheaper than the brand versions, but yet they're the same thing. And we can also, since you have Medicare, they have resources as well to cover the cost of the medications. And for your wife, we can call, Medicare also has some in-home care for respite, And there's also an elderly hotline that is a really good resource. I can give you the number for that. And there's also the Central Florida Senior Resource Alliance as well, which is really helpful to patients who are in your situation. So don't worry, there is help.
Okay.
Okay.
Joe, I have some great news for you. The PGA Tour decided that they're going to help pay for some of your meds and for your wife's care.
That's great.
Yeah.
Good to hear.
So this story does have a happy ending. For BSN News, I'm Livia Nagy. Thanks for watching.